The Gauteng Health MEC is due to visit Chris Hani Baragwanath Hospital today. That's after a picket by medical staff who are losing their jobs at the end of the month. The hundreds of nurses and doctors were hired at the height of the COVID-19 pandemic, but now the province says it can no longer afford them. For more, let's cross to reporter Lindokuhle Xulu, who is at the hospital. Linda, what's the latest? Have perhaps some of those staffers from yesterday that were picketing gathered, just waiting for the MEC to address them?
Well, we understand that this will be a meeting between some stakeholders within the hospital, Baragwanath Hospital, but also this will include the management of the hospital, that is the CEO. We are just outside his boardroom, and we are expecting that at any moment now we'll be called in to just hear what are some of the resolutions that are taken with those engagements. But the MEC is inside here visiting Baragwanath Hospital. Yes, she will be addressing, in fact, issues that we saw arising yesterday. The pickets that we saw were about 800 workers, we understand, stand to lose their posts. They were initially hired to mitigate against the pressures of COVID-19, but as you rightfully said in that intro, they can no longer afford these, according to what the health department in Gauteng is saying. But these are not just the only issues that will be limited to in terms of what will be discussed here. We also know of issues such as food shortages in this particular hospital. We also know that the NOSA, when you spoke to them yesterday, said that in fact their staff had to cough out money from their pockets to actually try and feed some of the patients that are here. So those are some of the issues we understand the MEC will be speaking on. It's not necessarily a setting of a mass meeting, but we do understand that all stakeholders in this matter are represented, and at any moment now, just outside the CEO's boardroom, we will be going in to get a sense of what the update is, of what the resolutions are, and what the decisions are from what we know are the matters. But just to recall some of those, there is 800 workers that are at stake in terms of their jobs. They were hired during COVID-19 to mitigate against that pressure. Secondly, the issues of food shortages in the hospital and around Gauteng to feed patients is another issue that is at hand. So we are expecting Dr. Nomathemba Mokheti to in fact update us on some of the things that had been happening to reach this point, and also just give us a sense of whether they are changing their stance when it comes to that protest that highlighted that about 800 workers in this particular hospital will be out of a job come the end of the month.
All right. No, Lindokuhle, clearly a host of issues there to be dealt with. Thank you very much. That's our reporter, Lindokuhle Xulu. To this now.